very good morning to one and all. On behalf of the Director and the staff of the Central Health Education Bureau, I extend a warm welcome to all the participants as we gather here today for the Modular Training Program on Metabolic Disorders for Ayush Master Trainers. This training program, being jointly organized by the Ministry of Ayush and the Central Health Education Bureau, aims at the capacity building of the master trainers from Ayurveda, Homeopathy, Unani, and Siddha streams, representing various states and union territories. Before we get into the details of the training program, I would like to introduce our institute to you. That is, Central Health Education Bureau was set up in 1956 on the recommendations of the Bohr Committee and the Planning Commissions of India. Since its inception, CHEB has been playing a crucial role in health promotion activities by disseminating vital information to the public and fostering healthy behaviors to improve the overall health and well-being of the population. Along with health promotion, our organization's mandate also includes awareness generation, capacity building, and conducting behavioral research. This training program has begun yesterday, that is on 27th October, and we have already trained around 50 Ayurveda master trainers from various parts of the country. As you are aware, today's training program is specifically for the homeopathy master trainers. And right now, our director ma'am is not available now. She's in a meeting, so she will be joining us later. Now, I kindly request Dr. Raghu sir to begin the session. To introduce sir, sir is an accomplished Ayurvedic physician and administrator with over 20 years of experience in Ayurveda, public health policy, and traditional medical systems. He holds an MD in Ayurveda from Government Ayurveda College, Trivandrum, a BAMS from Vaidyaratham Ayurveda College, Ollur, and a diploma in Yoga and Naturopathy recognized by CCRYN. Currently, Sir serves as an advisor in the Ministry of Ayush with additional charge as a Deputy Director General Ayush at Ayush Vertical, Directorate General of Health Services. His previous roles include Joint Advisor, Deputy Advisor, and Assistant Advisor in the Ministry of Ayush, as well as a Research Officer in the Department of Ayush and Postgraduate Teacher at Gujarat Ayurveda University, Jamnanagar, with an experience in teaching international students. Dr. Rakel has represented India at numerous international forums, including WHO meetings, Indo-US Health Dialogues, SEO events, and global Ayurveda conferences. He is a recipient of multiple awards, including 2 gold medals for best paper presentations and the prestigious Vagbhatta Puraskaram. Additionally, he has contributed to key publications under Ayushman Bharat and NRHM. So I kindly request all of you to join us in welcoming sir. Over to you, sir.
Namaste all. So a warm welcome to the modular training for the master trainers from the states and UTs on metabolic disorders, the management of metabolic disorders in homeopathy system of medicine. So it is really a very important occasion as far as the Ayush vertical in DGHS as well as the Ministry of Ayush is concerned. Some of you might have attended this master trainers program in the musculoskeletal disorders. So how many of you attended that training program? Yes, only 2, 3. Okay, so only 3 master trainers attended that training program. So after the completion of that master trainers program, what have you done in the field? Whether you have imparted the further training to the other medical officers? Okay, in your so you are from Karnataka. So you have conducted the training programs to the how many trainees you have conducted? 3 batches. Okay, so you completed the entire trainees. Yeah. State. Okay.
3 batches, total 15 doctors.
Okay, 15. Okay. So what I advise actually, the number can be little bit more actually because 15. Because anyhow you have to take the effort. So naturally, ideally it should be a group like this actually. 50, 60 people can be got trained at a one single thing actually. And regionally, first of all, you can attempt then, because covering the entire state may take further cascading approach actually. So what about others, those who trained earlier? Have you trained your consecutively further training programs? Those who already got the training? आपने कुछ ट्रेनिंग करवाया था, but is a bigger state actually, so naturally 70 this. So what we are supposed to do, we have to systematically conduct the training program. So yesterday also we discussed it actually with the Ayurveda master trainers also. One specific program schedule we will be circulating to you, and state governments also. So there is a need to conduct the training program to all the medical officers who are actually deployed in the public health facilities, Ayushman Arogya Mandir CHOs, then your standalone Ayush hospitals, then co-located facilities also. So like that, that training program has to be completed over a period of next 4 or 5 months actually. That is what is expected actually.
How about the financial assistance for the
Financial assistance already provided under the National Ayush Mission. There is a specific provision. Some of the state governments has already availed that for the training purposes actually. So under flexible activities also they can propose actually, state governments actually. So we have advised all the state governments, and we will write to all the states also. So that is what, this is the initial what I want to say about that. However, a very warm welcome to all of you to this training program. So today's training program is structured like this because you know that most of you are already practicing in the field. Many of you are actually having the administrative functions also. Some of you already deployed in the district level also. So there is a what you call a mix of different orientations of the people who are actually practicing in the field. So in the first session, we would like to give you the brief on how these objectives of these training programs and how we arrived at standard treatment guidelines and how to conduct the further training programs. All these things will be briefly mentioned in the first session. Thereafter, how it can be aligned with the National Ayush Mission. For that, one officer from the National Ayush Mission will be orienting you in the context of you may be knowing that NPCDCS program, which is actually run by the National Ayush Mission now in the 6 states, and some other states also availed that financial assistance. So whether we can align these STGs along with that program also, because one of the mandate of NPCDCS is diabetes mellitus actually. Along with that, the metabolic disorders also have obesity, because obesity is now also the priority of the government of India in a convergence mode. So dyslipidemia, even non-alcoholic fatty liver disease. So any of these metabolic disorders, whether we can have that kind of program approach. So if at all there is a program approach, then there is a need of clear-cut protocol. So how the STG we help into devising that what you call the standard guidelines, and based on that whether the reporting system can be made. So all these will be discussed in the sessions. Thereafter, the technical aspect will be discussed by from the CCRH technical experts who actually contributed, who actually steered this STGs to its present form. Dr. Divya Taneja and Dr. Roja both are here actually. In addition to that, their regional unit, Dr. Baidurjaya Bhattacharya, he is also present from Kolkata, West Bengal. So they will be orienting you the technical aspect of the STG, wherein at what stage you have to identify the disease condition, at what stage you have to refer the cases, at what stage, what kind of homeopathy interventions will be provided, and within the ambit of your essential drug list which has been provided, and along with essential drug list, some more drugs may be indicated in the STG. So how it can be locally purchased the concerned state actually for the benefit of the patient. So all these will be discussed by them. Along with that, we have a modern expert also will be orienting you on the modern diagnostic aspects as well as the differential diagnosis and even red flag signs. So these aspects will be covered by an expert also. So in this way, we have structured this training program. So similarly, when you are undertaking the training program in the states also, you have to induct one modern expert from your counterpart also, who is actually, and before that you can circulate these STGs to them so that they will be acquainted with these STGs so that they can come prepared to orient your trainees. And also some institute you have to identify, preferably your teaching institution. In teaching institution you can identify the 2-3 regions, for example West Bengal, suppose Kolkata, some other 50-bed integrated Ayush hospital, some institute you can identify where this training can be conducted. Similarly, after training program, just now we have circulated the training assessment and post-training assessment. So all these are very important things so that at least what is the oriented output of this training program can be assessed based on that. And after 3 months of imparting the training program, again you can make an assessment whether any change in the, after the implementation of the TG, any change has happened to the patient outcome as well as the diagnosis as well as the referral. These 3 aspects is very important: referral, patient outcome and diagnosis. So based on that, prepare. We will try to prepare a format to that effect actually. After 3 months or 6 months, you can report back to us. This is the outcome of that STG training. And further, because STGs are not one, always it is dynamic. After 1 year, some modern advancement came, some new thought process came into the system. So naturally, that can be integrated into the STGs with the approval of the steering committee. Or so that kind of inputs also you can provide, because basically you are implementing the STG. So you know better what are the field level problems and other things. So based on that also you can provide that inputs to us. So with this initial introduction, let us have see these objectives of modular training. Traditional medical system like Ayurveda, Unani, along with that as a complementary system, homeopathy also have the holistic approach to the health and disease. So that itself makes us to understand the depth of the science as well as how to converge with the existing public health systems in the country. So preventive care and health promotion is one of the important component. So that we would like to emphasize. Not audible? Okay. So as far as the preventive care and health promotion is concerned, this is one of the important focus area as far as any traditional medical system is concerned. So through homeopathy also, we are making many preventive approaches to the illness. So based on that, when we speak about the metabolic disorders also, appropriate IEC campaign has to be rolled out actually. So that is why after this training program, a specific IEC module will be circulated to you, and in all healthcare facilities, in all public health outreach activities, you can dissipate this IEC campaign. Particularly, you know that these disease conditions are very important as far as the country is concerned. Very younger generation are actually afflicted with the disease condition, whether it is dyslipidemia, whether it is non-alcoholic fatty liver diseases, whether it is diabetes mellitus, so whether it is obesity. So in all these respects, actually, we have to make a very specific preventive approach as far as these disease conditions are concerned. So homeopathy is the right platform through which we can intervene, and based on that, appropriate IEC module has to be massively developed, and it has to be dissipated in the community in a campaign mode. So in the campaign mode, when you are doing it actually, either through the public health outreach activity, or otherwise Ayush Gram, under the National Ayush Mission, Ayush Gram has been supported by the ministry. So on that ground also you can develop it, or even very specific wherever other campaigns are happening. For example, Poshan Ma campaigns are conducted in many September and October. Then obesity campaign, somewhere obesity campaign has also been conducted. So any kind of such public health campaign, these aspects can be appropriately percolated to the community. Then another aspect is actually institutional care. After the active management, then this palliative care and rehabilitative care, that is also very important actually. This is also one of the strength area of traditional medical systems and including the homeopathy. So where we can chip into that actually, your tertiary care hospitals, homeopathy teaching hospital, etc. So that also will be discussed in the STG. Then cost-effective interventions, no doubt actually. As far as many of these disease conditions in the early stage, if you are able to identify the conditions and preventive management, we have given a separate chapter for the preventive management. So that itself will give some kind of cost-effective strategies for these treatments. So the STG will focus on all these aspects actually. Yeah, rather STGs should focus on all these aspects. Then it should be evidence-based. As you may be knowing that over a period of last 1 or 2 decades actually, large number of publications came, and even though the evidence generation or evidence level may be different actually. Basically from some kind of observational data to control trials, or even to some studies which may even extend into the systematic review or even meta-analysis. So whatever it may be, different levels of evidence have been created, and that has been populated into various research publications, and even Ayush portal, which has been maintained by the Ministry of Ayush, that has been by the Research Council, that has been appropriately integrated into that. So these evidence-based, wherever it is applicable, that has been already integrated into that. Then what is the infrastructure? We have large number of hospitals and Ayurveda facilities, homeopathy facilities. 3,885 Ayush hospitals are there. Among that, significant number are homeopathy hospitals. Then 37,804, both under central and state governments actually. So all these facilities should be able to cater these needs of the patients in the metabolic disorders through appropriate clinical protocol. In addition to that, many of the Ayushman Arogya Mandir, Ayush, the community health officers deployed are homeopathy practitioners. So there also very specific guidelines have been given in the context of the management of the non-communicable diseases actually. So in that, one of the important component will be these metabolic disorders. So it consists of 3 aspects. One is institutional care. Second one is actually outreach activities. Third one is the what you call domiciliary and whatever the rehabilitative care which is supposed to be done. So in all these 3 aspects actually, the STGs will be a pivotal for further strengthening all these programs. Then in addition to that, there is co-located facilities in the entire states and UTs, even though the number is still not saturated and there are a lot of logical issues as far as its administration and other are concerned. However, within the limitations also, many of these co-located facilities are providing the functions which is actually supposed to be done by the homeopathy practitioners and other systems of medicines. So based on that, all these in this background that we have thought that there is a need of standard treatment guidelines. So currently, whether we have standard treatment guidelines, Central Council of Research in Homeopathy already prepared the standard, a lot of standard treatment guidelines have been prepared, and it is still continuing actually. But the requisite for the integration and convergence aspect actually, we thought that there should be a dialogue between the various medical experts as far as these disease conditions are concerned, so that stage-wise identification of the diseases and appropriate referral system. So that can be developed only if with the appropriate consultation. Based on that, the existing quality assurance mechanism remain fragmented. Fragmented in the sense that many of you may not be knowing whatever the STGs prepared so far actually by the research councils or other national institutes. And even standardized clinical training on evidence-based guidelines was limited, because there are 2-3 domains in which STGs are prepared. One is what are the existing documentations in your, whatever the classical textbooks in homeopathy or any other systems of medicines. Another one is actually the experience of the practitioners. Third one will be the research-based documentation. So far the research-based documentations was very limited in existing STGs, so that it was emphasized that whenever the STGs are made, over a period of last 1 or 2 decades, whatever the advancement came in terms of the research, that has to be appropriately documented, and that should be part of the STG. So that was also considered. Then another point is, you may be knowing that this is not relevant for the homeopathy, because homeopathy already have the same ICD as followed by the biomedicine actually. So however, in other traditional medical systems, due to their nomenclature is very specific to that system of medicines, that ministry in collaboration with the World Health Organization has made the ICD-11 as a separate chapter for that other traditional medical systems like Ayurveda, Siddha, Unani. So wherever possible, we mention that these ICDs should be scrupulously followed in identifying the disease condition, including the provisional diagnosis and confirmed diagnosis. Similarly, red flag signs and referral criteria. One of the important area where there is a need of consensus between the biomedicines and the traditional medical systems are the area of where you refer the cases, at what stage you refer the cases. Every system, they will claim that we can manage these conditions independently, but ultimately, as an impartial manner, in a scientific manner, whether at a particular stage, whether that disease condition follow within the limits of that particular system of medicine, that has to be assessed. So based on, for that assessment, what is required? There is a scientific discourse is required, scientific consultation is required. So based on that, actually, a systematic process has been evolved to identify, and this has been thoroughly discussed and debated, and finally, the red flag signs have been evolved. So how it has been evolved, Dr. Roja and other technical experts who are actually participated in that discussion, they will highlight to you further in their sessions. Similarly, interdisciplinary management approaches. There, apart from the diagnosis and referral criteria and even red flag signs, the differential diagnosis, the other aspect, including the dietary aspect, the yoga, the physiotherapy, all these has been integrated into your STG actually. Ultimately, no single system may not be able to completely, entire course of the treatment cannot be sometimes manage the disease condition. That is why we have an approach to multi-system integration, multi-system convergence. So the STGs also reflects that aspect. Yoga has been integrated into all these disease conditions under the metabolic disorders. Similarly, standardization, no uniform national framework to harmonize diverse clinical practices. I don't know about the homeopathy, but in other traditional medical system, north side, some practices actually going on. South, different practices are going on. West, another practice is going on. So there was no convergence between the different practitioners and their practices in different part of the country. Even in homeopathy also, this may be there actually. In West Bengal and other areas of the country, there may be some differences in their clinical practice, approach to the patient, even identification of the disease conditions. So all these has to be, through consultative process, has to be converged, so that at least the students and the practitioners will not be any kind of confusion when managing the cases. So based on that, the STG try to address all these issues. limited scientific evidence generation, absence of a consistent clinical documentation, audit and data sharing mechanisms, difficulty in establishing measurable outcome aligned with the global standards. So measurable outcome, ultimately, what is the requirement? In a clinical outcome scale, patient should get some satisfaction, some level of satisfaction after this kind of management. So whatever the satisfaction which is subjectively or objectively, that has to be clearly documented. So that documentation is also part of the STG that in all disease conditions, it has been clearly indicated. Then concept of STG is not new to healthcare. They have been long recognized as essential tool for ensuring evidence-based, standardized and rational treatment practices. Variations in practice across regions and institutions can lead to inconsistent patient care and hence outcomes. Already I mentioned. Modern research methodologies and outcomes data need to be incorporated alongside classical traditional medical system principles. Uniform guidelines facilitate dialogue and coordination between Ayush and modern medicine practitioners, vital for integrative care and effective referrals. STGs serve as a foundational resources for newly inducted Ayush medical office. This is very important. Many of the state governments, new recruitments are happening. Some of the state governments specifically, for example, hundreds and 200s of number of new medical officers are recruited. And generally, many of time their training requirements are overlooked. So what we have to do, whatever the STGs that we prepared, actually, that should be first imparted to the newly recruited medical officers. Why it is required? In the academic curriculum, you study many elaborate things, actually. But you have to concise it within your available resources, actually. Every level, certain resources are there. For example, आयुष्मान आरोग्य मंदिर. आयुष्मान आरोग्य मंदिर में काफ़ी दवाई वगैरह अवेलेबल नहीं है. जो limited resources में, whether how you can manage. Beyond that, what is your role to refer? How you will refer the cases, actually. So this is what exactly the STG says. And even the diagnostics also, there is limited diagnostics available in the Ayushman Arogya Mandir. Even you can say 2-3 only may be available, actually. So within that 2-3, whether it is possible to actually diagnose the case, if at all, if it is able to diagnose the case, then whether exactly the same kind of medications which you require, you studied in your teaching curriculum, whether it is available. So it may not be available. So in that context, actually, these STGs will be helpful to the newly recruited medical officers to manage within their resources. STGs provide a credible basis for inclusion of Ayush treatments in public health programs and insurance schemes. As you may be knowing that now the ministry along with the research councils are working on how to integrate with the requirements of the insurance sector also. Some STG protocols that we have formulate. We have already formulated some STG for the purpose of the insurance providers also. So the base will be, again, will be taken from whatever STGs that we have prepared for the metabolic disorders and musculoskeletal disorders. So based on that, there is a wide spectrum of stakeholders for these STGs. Not only your practitioners, not only your administrators, even the insurance sector providers, even later stage, we hope that even under the PM, ABPMJY also, these kind of STGs will be largely integrated into their system when the Ayush will be incorporated into that. What is the methodology adopted for preparation of these STGs? We have a national steering committee under the chairmanship of Directorate General of Health Services, who is actually the technical expertise for the Ministry of Health and Family Welfare in all public health aspect, actually. So under his chairmanship, there were the DGs of different research councils, including the Central Council of Research in Homeopathy, Ayurveda, Unani, Siddha, all the DGs were there. Then nationally, we have also inducted many private experienced practitioners also, so that many of the expertise lies in the private sector also. So based on that, we have also inducted eminent private practitioners who have that capacity, particularly in this particular spectrum of diseases, that is metabolic disorders. Modern medicine experts, particularly those who from the Lady Hardinge Medical College and RML hospital, those having very clear orientation as far as these metabolic disorders on modern perspective, that is identification, diagnosis, differential diagnosis, and even the referral criteria, even red flag signs. So they help us to frame these guidelines. Then we have a supporting groups, a drafting committee was there. Secretariat, we have selected the Central Council of Research in Homeopathy as the secretariat for that to draft the documents. Then it was reviewed by the respective national steering committee. Once that documents have been approved by the committee, then again it has been circulated to an editorial board, which they fine-tune the language and other aspect they will see, and finally these publications. And the key features are that multidisciplinary and evidence-based, clinically sound and implementable across healthcare settings, systems, Ayurveda, Siddha, Unani, Homeopathy, and yoga integrated in all these documents. Then after that, what happened? These final STGs are formally launched and disseminated through national level master training programs. So musculoskeletal disorders training program we have conducted. After that, in the last National Ayush Mission conclave held at Kaivalya Dham in Pune, this metabolic disorders document was also launched by the Honorable Minister for Ayush. Then all these publications are now available in the public domain. Under the website of the Directorate General of Health Services, if you just search the clinical establishment division, there the STGs, all these STGs including homeopathy are available. Then under the Ministry of Ayush, under the heading of Public Health, under that caption, these STGs are available. And we will be already circulated to the national commissions and the national commissions of the homeopathy also to widely circulate to all the teaching hospitals. So now your role is only to further cascade these training programs to all the field level officers with the support from your administrative officers, state level administrative officers, and region wise you can select some teaching institutions and you have to conduct the training program. Then identification of the priority conditions. So we have identified these priority conditions based on certain initial consultation and discussions, which was supposed to be prioritized because based on the strength of the Ayush systems of medicines, including homeopathy, and also the relevance in the public health program. Because obesity is, as you may be, this is very important, one of the consideration in the government of India. That is why it has been taken. Non-alcoholic fatty liver disorder, it is highly now increasing in the public health as a menace. Similarly, dyslipidemia, because generally people not tends to manage dyslipidemia. When it matures into many other disease conditions, then only the people actually treat these conditions. So if early as possible, if you are able to manage this dyslipidemia, that will prevent to full-fledged any kind of metabolic syndrome or metabolic disorder. So that is also can be addressed by the traditional medical system. Then a standard template we have prepared, how to collate these informations. Based on that standard template was prepared. Then collection of the evidence that was also made by research councils. Obviously they have the various kinds of database, and based on that whatever the evidence generated so far in the system of homeopathy, which has been collected by the CCRH. Then this is the standard template you can see in the document already there with you actually. Nomenclature of the disease, case definition, introduction, clinical presentation, clinical examination, differential diagnosis, supportive investigation, essential and advanced, then diagnostic criteria, modern and Ayush system specific, principle of management, and the important things are actually this red flag signs and referral criteria, line of treatment, prevention management. That is very important. Many a time we often, even the traditional medical practitioners also tend to forget. This is one of the important criteria for any kind of chronic illnesses actually. This dietary management is very important actually. So wherever it is required actually, healthy and unhealthy dietary regimens and yoga and pranayama has been integrated to all these disease conditions. Curative interventions with respect to clinical diagnosis at a level 1, 2, 3. Level 1 means the lowest level of healthcare system, that is either Ayushman Arogya Mandir, Ayush clinic or dispensary, or even the primary health center can be considered as a level 1. Level 2 can be community health center or 20-30 बेड हॉस्पिटल्स ऑफ रूटीन जो केसेस जो डील कर रहे हैं वो आयुष हॉस्पिटल को लेवल 2 बोलते हैं. Level 3 means what? The teaching hospitals and higher tertiary care hospitals like 50 bed integrated Ayush hospital, all these can be considered as level 3 based on the services, the specialities which is actually offered by these clinical centers are considered as level 3. So based on these different levels and the different approaches and the different resources, everything has been mentioned in this STG. So as I mentioned that for Ayurveda, Siddha, Unani, ICD 11 chapter, separate chapter module that has been integrated. For homeopathy, already existing ICD 11 as well as 10 along with the Namaste portal, whatever the nomenclature which is given by the Research Council, has been integrated. Then red flag signs, then facilitates interdisciplinary learning, treatment options at various levels of healthcare based on essential drug list. And you may be knowing that for each system of medicine, there is an essential drug list has been notified by the Ministry of Ayush. So we have tried to almost link with these interventions in the EDL. However, there are certain disease conditions which the experts opine that beyond this essential drug list, some of the medicines can be also can be included. So based on that, that has been included, and no worries. Actually, if at all that not available within the existing system itself, you can manage. But suppose if it is you feel it is very essential at a one particular level, then you can think about local purchase and other things. You can purchase that medicines and provide to the patients. This is the primary beneficiaries kone Ayush practitioners throughout the country, practitioners in the centers, emerging integrated healthcare like AIMS and co-located Ayush healthcare facilities. Yeah, ultimately these STGs will be dissipated even for the modern practitioners also. So they will understand what are the strength of traditional medical systems, and what you call an environment can be created wherein appropriate referrals can happen. And you know that within 1 day or 2 days, this referral will not be happened only on the basis of the trust, only on the basis of evidence only. This referral criteria and the referral system can be developed. So it is not a very, I don't expect that within the publication of these STGs immediately all the referrals will happen. ऐसा नहीं है, लेकिन slowly we have to evolve these standards into the field. When you practice as per the STG and if you showcase this evidence, showcase this documentation, ultimately there will be one time when they will agree that there are certain scope for these kind of referrals, and we can also refer the cases to homeopathy or other traditional medical systems. Secondary, program managers, public health administrators, researchers, and training institutes facilitating interdisciplinary learning. So many a time you may be knowing that Indian public health standards have been already evolved by the Ministry of Ayush. So IPHS में ऐसा है अभी different standards has been laid down. One standard is actually infrastructure. Second is the equipments, furniture, and diagnostics. Third one is on the essential medicines. Fourth one is clinical governance and quality aspect. So clinical governance and quality aspect में हमारे पास अभी एक set of guidelines में enabling set of guidelines are required. उसी में एक important one is STG. So STG अभी हमने progressively we have prepared about musculoskeletal and metabolic disorders. We are now working on dermatological disorders. So after that we will be coming to some, for example, pediatrics and other things. So every system wise, every segment wise, it is intended that the STGs has to be evolved over a period of next 1 or 2 years actually. So that will be adding to the standards of Indian public health standards. Every facility in the state, whether it is Ayushman Arogya Mandir, primary health center, community health center, district hospital, or even integrated Ayush hospital, everywhere these set of standards has to be implemented. How it can be implemented? Through appropriate orientation to the practitioners. So based on that, secondary level में even policy makers के लिए भी ये knowledge is very important. In ultimately the beneficiaries will be the patients, क्योंकि suppose ये सभी किसके लिए हम कर रहे हैं? STG एक it is a methodology. STG is basically a methodology to understand, to perceive and to provide the services. So वो service provide करने के बाद किसको benefit होगा? Ultimately patients को benefit होगा. So वो outcome, that is why initially मैंने ये mention किया आपको, आपको 3 महीने के बाद, इम्प्लीमेंटेशन का 3 महीने के बाद या 6 महीने के बाद आपको इसको डॉक्यूमेंट करना है. पहले कितनी पेशेंट्स आता था एंड व्हाट इज द पेशेंट सेटिस्फैक्शन स्कोर, एंड आफ्टर 6 महीने के बाद इसी डिसीज कंडीशंस में whether there is an improvement in the patient footfall, whether there is improvement in the patient outcome, or whether there is an improvement in the services that we are actually providing. So based on that, one documentation you have to make and report back to the ministry. So this is the rationale that we are actually saying enhances clinical competency, documentation and rational practice in Ayush health facilities. Modular training ensures consistent understanding and uniform application of STGs. Diversity in practice styles across systems and regions highlights the need for uniform clinical guidance. Growing number of facilities and practitioners demand systematic training. नेशनल लेवल मॉडुलर ट्रेनिंग में अभी जो आपने जो आया था, हमको आपको सपोर्टिंग मटेरियल्स वगैरह हम दे देंगे. ऑल द पीपीटीज इसमें जो प्रेजेंटेशन करते हैं वो भी आपको शेयर करेंगे, और इवन द स्ट्रक्चर्ड एक्शनेबल पॉइंट अगले 1 साल में आपको क्या क्या करना है इसके बारे में आपको इधर से आपको शेयर करेंगे. फोकस एरिया, स्ट्रक्चर, कंटेंट, रैशनल, एविडेंस बेस्ड रिकमेंडेशन, प्रैक्टिकल क्लिनिकल एप्लीकेबिलिटी. देन ये हम सेंट्रल हेल्थ एजुकेशन ब्यूरो से कर रहे. स्टेट लेवल में भी CHEB ऑलरेडी मेंशन दैट रीजनल, अगर वर्कशॉप आपको रीजनल ट्रेनिंग प्रोग्राम करना है तो दे विल सपोर्ट यू टू कंडक्ट दिस ट्रेनिंग प्रोग्राम्स. फॉर्मेट है हाई इम्पैक्ट मल्टी डे सेशंस. Then outcome, participants become master trainers to conduct state and district level orientation, creating a cascading training model. Vision है to promote standardized, safe and effective Ayush-based clinical care through competency-driven training, build the capacity of Ayush practitioners to apply STG consistently, ensure evidence-based and patient-centered clinical decision-making, strengthen health system integration through harmonized treatment protocols and referral systems, contribute to improved public health outcomes through standardization. Ultimately, we have to report back to all the policy makers that through homeopathy, under these metabolic disorders, we can effectively manage these and these conditions, these and these stages actually, so that appropriately referral system also can be integrated and more clinical documentation can be done through these STGs. This is the outcome measure that we have to provide to the policy makers. Then system strengthen documentation, attitude foster ethical patient-centered care, understand the principles of structure of Ayush STG, skills apply STGs in diagnosis, prescription and follow-up. Then state level rollout and dissemination में आपको ये national level के बाद आपको state level rollout करने के लिए enabling guidelines आपको इधर से भेज देंगे, and with copy आपका administrators को भी directorate में या commissionerate में हम ये letter लिखेंगे. उसके बाद आपको ये roll out करना पड़ेगा. States are encouraged to establish feedback mechanism for practitioners to share queries, field level challenges and suggestions for future STG update. This is very important. अभी हम जो प्रिपेयर किया नेशनल लेवल कमेटी वगैरह मिलाकर प्रिपेयर किया, जब ये इम्प्लीमेंट करेंगे फील्ड में कुछ प्रॉब्लम तो आ सकता है. जैसे मैंने बताया दवाई ऑलरेडी एसेंशियल ड्रग लिस्ट के अलावा भी हमने इंक्लूड किया, लेकिन वो भी शायद सफिशिएंट नहीं होगा, या कुछ दवाई ज़रूरत भी नहीं लग रहा है एक्चुअली आपको. तो ये सभी इनपुट्स भी आप दे सकते हैं, सो दैट फ्यूचर अपडेशन में ये दिस विल बी हेल्पफुल. STG is not static. Again, I am saying, always it is dynamic. Every 2 years, the implementation has to be seen based on the current updates, current research documentation, the practical experience actually. Certain diagnostics may be redundant. मतलब कुछ लोग सजेस्ट किया होगा these and these diagnostics are essential. मे बी उतनी आपका गांव में करने में दिक्कत होगा, तो इसमें ऑल्टरनेटिव कोई डायग्नोस्टिक से या ओनली सब्जेक्टिव एंड क्लिनिकल आउटकम स्केल से वो डायग्नोस कर सकते हैं. सो ऑल दीज सजेशंस कैन बी ब्रॉट इनटू द फर्दर डेवलपमेंट ऑफ दिस STGs. ensure continuous and flexible and wide-reaching capacity building. Ayush Vertical is leveraging digital health platform for the dissemination of STGs and training content. Wherever possible, we will use a digital platform to even for the documentation of this STG, the outcome, whatever the outcome you are reporting to us, for that also we will try to make integrate into some kind of digital platform. States are encouraged to establish feedback mechanism for practitioners to share queries, field level challenges and suggestions for future STG updates. Resources are disseminated through national commissions. Since our younger generation has to be more oriented in this STG, we requested already आपका national commission से हमने बता दिया ये सभी appropriately all the teaching institutions में circulate करना चाहिए. Not only circulate करना है, it should be integrated into the curriculum. Then only it will have a benefit actually. Particularly in the final year students के सामने या interns के सामने this STGs has to be clearly that kind of awareness has to be provided. Then that can be एक system can generate. Then उनको दोबारा जब public health facilities में जो मिलेगा even private practitioners जब वो practice कर सकते हैं तो at that time STG can be appropriately followed. So expected outcome क्या है? Uniformity in service delivery across facilities, increase patient safety and satisfaction, enhance clinical competence and confidence, strengthen integration with the national health programs, evidence-based data generation for policy decisions. So अभी आगे आपको ये ट्रेनिंग सभी स्टेट्स में अभी एक्सपैंड करना है, continuous updating with emerging research, integration with Ayush Grid and digital learning platform, link outcomes with accreditation and quality assurance mechanism. Even STG can be accredited with NABH वगैरह accreditation आपका कई facilities में हो गया है अभी, आयुष्मान आरोग्य मंदिर में भी, आयुष हॉस्पिटल में भी. So STG's documentation is also can be one of the line item as far as this accreditation process is concerned actually. So this is what I would like to brief you on the need and further how you will impart the training program. So इधर से आपको सब कुछ documents आपको मिलेगा actually including this STG, and further we will write to the states also to appropriately conduct this training program over the next say 6 months में कुछ training program तो conduct कर सकते हैं. And अभी last मैंने feedback के मुझे समझ गया है, even though training programs conducted but पूरा मतलब मेडिकल ऑफिसर्स को कर नहीं पाया, सो इसके लिए भी हम एक बार रिव्यू करेंगे कैसे करना है, ये सभी अप्रोप्रिएटली हम ओरिएंट करेंगे. सो थैंक यू. इफ यू हैव एनी clarifications or doubts or suggestions that you can tell now.
So that they should include all these things in the PIP or in the SAP state annual action plan, so that there will be no financial burden. Otherwise, states are unable to do such type of training program. That is the thing. Sure, sure. Yes, yes, there is a scope. There is a scope, but this is a new things. This is STGs that should be included.
Yes, this we will be including in our next financial में National Ayush Mission जब improve कर रहे actually. This as a new component. This training program for the standard treatment guidelines will be included actually.
Sir, thank you. Sir.
Included, yes.
That is included. That is within this.
Because already musculoskeletal disorders के लिए public health program था, इसलिए वो include किया.
Public health program.
Yes, yes. Metabolic disorders के लिए एक separate public health program अभी है ही नहीं है. But NPCDC ऐसे एक program है, but उसमें पूरा ये disease conditions आ नहीं रहे actually. अब वो training program हम separately include करेंगे capacity building के लिए.
Sir, the Indian Public Health Standard Guidelines issued by the Government of India, there is a lacuna between the states and the Government of India guidelines. Like for example, I'm not very much sure that there should be a population-based doctors recruitment through the in a state, that likewise that allopathic, Ayurvedic, homeopathic, etc. And can we know about the correct Indian public health standard guidelines that what population caters to the doctors in a such state that this is the Ayush ratio, this is the allopathic ratio?
आप
Because there is the, I am from the state of Punjab. I am giving you example, and my colleague is Dr. Richa Bhardwaj. We are both representing from the state of Punjab. You will be astonished that the our recruitment has been a cut 24-year span of time. Last recruitment of that was conducted in the 1995, and we got recruited in the year 2018. This lack of the gap between this lack the Ayush hospitals declining and the shutdown of the facilities. Moreover, there is the gap bridges between the system, brain drain, etc.
ओके एक्चुअली क्या है बेसिकली आईपीएचएस का स्टैंडर्ड्स इवॉल्व किया है उसी पर्पस के लिए स्टेट्स में काफ़ी रीजन से एक्चुअली प्रायोरिटी नहीं कर रहा था तो बेस्ड ऑन दैट एक्चुअली काफ़ी स्टेट्स में लॉन्ग टाइम देर वाज नो रिक्रूटमेंट सो इसलिए पॉपुलेशन नॉर्म्स के अनुसार फैसिलिटीज़ का नंबर भी हमने डिराइव किया है एंड बेस्ड ऑन दैट ईच फैसिलिटी में कितनी मैन पावर चाहिए इन टर्म्स ऑफ डॉक्टर्स सपोर्टिंग स्टाफ थेराप्यूटिक्स एंड अदर थिंग्स वो डिराइव किया है तो अभी एक दिन में तो ये इम्प्लीमेंटेशन करना मुश्किल है एक्चुअली क्योंकि इसमें लॉट ऑफ फिनेंशियल रिसोर्सेस आर रिक्वायर्ड सो फॉर दैट कंबाइंड मैनर में सेंट्रल गवर्नमेंट एंड स्टेट गवर्नमेंट हैज़ टू वर्क ऑन दैट एक्चुअली सो एक पर्सपेक्टिव प्लान बनाने के लिए सभी स्टेट्स को हमने बताया है एक्चुअली मतलब whichever can be achieved within the next 3 years, next 5 years, next 10 years. Like that, ultimately, these standards has to be evolved in the state government actually. तो उसको लिए whatever perspective plans के अनुसार national आयुष मिशन में support देना है वो भी हम consider कर रहे हैं actually. So that is what actually.
Sir, can we get the written that what are the
Already IPHS standard already public domain में available है. Everything is available actually. आयुष hospital and आयुष्मान आरोग्य मंदिर के.
okay.
My fellow colleague from the state of Punjab, he has highlighted a very important point that many of times we see that such implementations are remains limited within the urban setup, but we have a huge population, uncatered population towards Ayush for Ayush in the rural setup. So if in the future definitely that financial and other resources are very important and so respective state government has their own policies but at least in every block of the district if there are at least 2 such Ayush centers, integrated Ayush centers are to be developed, then I think that will be a very huge beneficial effect for the patients who are being catered. Each and every block should be covered. Thank you.
Population wise, what is the facility, the hierarchy of the facility? That means clinic कितनी population के लिए चाहिए, hospital कितनी population के लिए चाहिए, based on different एक तो demand and supply का context में भी हमने assess करने के बाद ही IPHS evolve किया है actually. So suppose ये पूरा adopt करेंगे तो as you suggested district में block में saturation तो हो सकता है actually different systems of medicines के साथ actually. So but it will take time actually as you know that अभी हमारे पास ज़्यादा even though 3000 and simultaneously what is our role is actually existing facility में कैसे quality improve कर सकते हैं तो STG is one of the important tool to improve the quality in the existing facilities उसमें हमको ensure करना पड़ेगा appropriately दवाई वगैरह मिलना चाहिए डॉक्टर्स को अपोज करना चाहिए सपोर्टिंग स्टाफ चाहिए then along with that prescription हम जो कर रहे हैं is based on some rationality actually. If that is happened, then we can make further statements actually.
Sir.
हाँ बताइए.
I'm Dr. Madhurekha Singh from Chhattisgarh state. Sir, we are already working on various national health programs that are launched by NHM. So we were in osteoarthritis and musculoskeletal diseases program. So what the main that problem that we faced in this is the lack of diagnostic facilities. So sir, I'm placed in a place which is 110 kilometers from the district. So it is very far, especially in Chhattisgarh, it's mostly tribal area, and hospitals, the major hospitals or the district hospitals are very far from the small units or primary units. So mostly the diagnosis is either made, so standard treatment guideline is given to us. They have already trained us everything. But the problem is it is very difficult for to convince the patient to go to the district hospital and get an investigation done. And even if they go there, it is very because of it is a district hospital, it's a allopathy setup, so they generally don't entertain these patients very well. And patients, so mostly the diagnosis is made on clinical basis and the treatment is done on clinical basis. So we don't have any evidence that our medicine is working and patient is getting cured by homeopathy or our system of medicine. So that is the main problem that we are facing.
Based on this standard guidelines of IPHS, अगर suppose state government stage wise अगर take up करें, suppose there are certain mandate. For example, आयुष्मान आरोग्य मंदिर में काफ़ी diagnosis is not expected actually. Diagnostic instruments are not expected. Only 3-4. Even the modern Ayushman Arogya Mandir maybe 8 diagnostic are actually indicated, including water testing and malaria, parasites and other things including. But हमने ये बता दिया at least BP, sugar वगैरह जो common जो essential है, that alone will be provided in the Ayushman Arogya Mandir. Whereas in the your full-fledged hospital, then appropriately to deal with these metabolic disorders, that kind of diagnostics are required. Whereas ultrasound and other things, for example MRI वगैरह जो चाहिए तो then आपको either in your teaching hospital, yeah, even the allopathic district hospitals and medical colleges, so you have to refer the patients. So that is the standard set of things actually. Even in IPHS also, we have clearly indicated that hierarchy. What are the diagnoses which is supposed to be provided at that kind of facility. So slowly we expect that the state will adopt these guidelines. Thank you.
Good morning, sir. I am Dr. Shakir Hussain from Andhra Pradesh. Sir, as you rightly said, that STG's importance in dissipating to the new generation, especially for the PGs and the final year students. Is there any step taken by this particular institute to be sent to the specific colleges wherein they can give these guidelines directly in their curriculum aspect?
No, basically the mandate is to send these things to the national commissions. So national commissions will be sending anyhow to all the teaching institutions.
Thank you, sir.
Okay.
Good morning, sir. Myself, Dr. Ayush Dwivedi. Sir, I want to ask that we can conduct this condition in virtual mode also. We have got 1100 medical officers in Uttar Pradesh. So individual one-to-one.
It is preferable that you conduct in the physical mode because that kind of मतलब training capacity building में ऐसा कुछ component है, but direct contact, eye contact, all these are very essential actually. So try to do it in the region wise actually. You develop, because if you are unable to do the entire medical offices, you can train certain intermediary trainers
wise.
actually.
Okay, we can
trainers
create,
also, and they will further train the other medical officers in their particular region.
We can do it in
Yes,
different
that you can do.
Thank you, sir.
So thank you all for your initial briefing session. So I hope that after this continuation of this all the training sessions, you will in a better position to conduct the training program in a cascading manner in the states. All the best. Thank you. Thank you.